Welcome to the 5 Codes podcast, where we discuss evidence-based methods to elevate yourself to the next level through optimizing the way you look, move, perform, feel, and connect. On today's episode of the 5 Codes podcast, we have a very special guest, my personal medical provider. Leah Streich is a PA who I have worked with for many years. She helped me start the entire functional medicine part of our practice, which I wanted as a key surgical adjunct for my patients to have access before surgery, to get them prepared to be as strong and metabolically ready as they could, and then to have the most incredible post-operative recovery experience. Leah was a really big part of that entire process, but also takes really good care of me and my patients and their overall health outside of anything that has to do with surgery. She's just a wealth of knowledge beyond anything that I can comprehend. And I get like nothing but the most incredible feedback from my patients who see her. Like, oh my gosh, Leah's incredible. Well, I feel the same way. So I really hope that you enjoy this episode as much as I did, talking through it and recording and learning. And you're going to get a lot of little actionable nuggets out of this. Enjoy. Leah, thank you for being here today.
Thank you for having me.
Yeah, Leah is very special to me because Leah is my provider, everybody. So like, this is really cool to have my actual medical provider here with me. And our relationship goes kind of before that, when I was trying to create an infrastructure basically for my surgical patients to have all the things that I would want to have myself in-house. And this included a lot of functional medicine preparation and recovery based things. And you were the person, you were the one, somebody who knows so much more about it than I ever could, and could help me pull the important factors out of the ether. That is a very amorphous field of functional medicine, right? It's developed even a lot since we've been working together.
Definitely.
Which is kind of cool. And Leah had so much more experience in it than really anybody else ever. So I was very grateful to have you be my provider and come work with me. So thank you.
Thank you.
And you still work with a lot of my patients now, in addition to having your own patients. And I think today I would just love to take the journey through a little bit of like what people are missing or could be missing, and this could be, maybe we'll see if it takes a little surgical tilt, but I think it's also just like in your health at baseline, right?
Mm-hmm.
Because we were just kind of talking offline a second ago about like all the tests that exist now that you can get, which is cool and important, but it's not generally a substitute for having like the direct relationship
Right.
to interpret the test. Even like as a physician who knows quite a bit and has a special interest in this, I need your help to be like, okay, what does all this mean? And I'll tell a story first.
Okay.
And I've told the story to a lot of patients about you, and the first time we ever sort of worked together, where I had been a very fit person, right? Very high level athlete at one point, but I always knew that I had like a little bit of elevated blood pressure, like just a touch. And I just always assumed it was familial, or that I was sort of managing the risk that I knew that that presented for me, I should say, on some level. I knew that risk presented by the high blood pressure, I was mitigating I was pulling every other lever that I could, because I was like eating as perfect could be. I was like a high level endurance athlete. I was doing all the things, right? But that one little like risk factor was sitting out there and it wasn't budging. And so this is, I think a lot of people are there. Like, and I was pulling these levers hard, right? Not even like I'm sleeping as well as I was like on it. This was my job, right? And this is what you don't know, even though I was in medicine. And so I see you, and we kind of like start, and I'm older at this point, I'm in my career, right? And we just do a thorough lab screening.
All the labs,
yep.
yeah.
And you also did a genetic test on me. And then we took all these pieces and put them together. And I feel embarrassed to say this, right? That like in like 10 seconds, you looked at all these things and you're like, oh, you have a heterozygous mutation for the way that you methylate folate, your MTHFR gene, and your homocysteine levels because of that are very high. And this gets into like the first thing you ever study when you're studying for your MCATs, like the electron transport chain, right?
Energy.
You have elevated homocysteine, that's making your blood pressure high. And I was just like, oh my gosh, I'm that 50-year-old super fit marathoner who drops dead running, right? That's going to be me. And this is why. And it's been there the entire time that I knew I had these things, but honestly, I had no idea why.
Right.
And in seconds, you like put all these things, you took an important, you sought the right data, and then you immediately put it together, which, I mean, quite literally changed my life, my lifespan. You changed my lifespan in like 10 seconds. So thank you. And I also love the part of the story is like the way that you changed my lifespan was I'm not on a medication forever, or I didn't have to, I changed my multivitamin and watched how much like fortified crap I would eat, which I wasn't eating anyway. So it wasn't even that, you know, it was just like, you need a methylated folate in your, and I'm like, oh my gosh, it's embarrassing to say that.
No,
all these
it's
years.
not, but it's so many people I feel like are in the same boat, right? We are doing all the things, and right now it's just information overload. Take this supplement, eat this diet, and I think that's like the art of functional medicine is having a relationship with a practitioner who can meet you where you're at. Like you've already pulled all these levers in your lifestyle, and so you just needed that extra data to kind of put together and link your risk factors and your symptoms to be able to like make that change, but helps you from a longevity perspective.
For sure. And I was definitely guilty of just like blindly taking supplements sometimes because I heard it could help things, which you have cleaned up for me drastically, you know, like, okay, maybe we look at these and ignore these. And so it's, you know, the total number goes down, but also it's much more curated based off of everything. Cause, you know, again, the multivitamin thing is embarrassing. So I was taking like a not particularly special multivitamin, you know, and that was doing it or contributing to it at least. And so, you know, I have this surgical lens that I like, it's my magnifying glass that I look at everything with. And, you know, so there's a lot of things that I talk about on this podcast all the time that fall under there. But then there's this world that you live in that I know when you're working with my patients and with your own patients that I just don't know as much about. Things that tie into what we're doing, but that I think are these mysterious worlds outside of like direct surgical preparation. What to you, when I say that, what are the areas that you think that are like, could be improved in people with their overall health, are going to contribute to their longevity and their health span, and but also like how things that can contribute to surgery but aren't like the main focus? What do you think some of those like key areas in your practice are?
I think some of the top areas that I see like every day would be hormonal balance, and not just giving bioidentical hormones, but looking at stress hormone pathways, the thyroid hormone, nutrients that affect hormones, and finding a good balance for each person at whatever stage of life they're in.
Yeah.
Gut health is huge. I mean, we hear it all the time now, like the gut-brain connection, the gut-skin connection. That's a key component of functional medicine, is that all systems are interrelated. We have all these specialists, right, that we see for cardiology and brain health and different things, but a lot of the time things, or all the time, things are interconnected. So if we go after optimizing the gut, then often people's brain feel better and their skin gets better, and you can just pull certain levers that affect the whole system together.
How do you look at somebody's gut? How about that? What does that look like?
So a lot of times I just start with symptoms, you know, are you moving your bowels every day? I mean, that's one of our major modes of detoxification. Are you having gas, heartburn, bloating? And how many of us have like some sort of like symptom that we just ignore because it's not enough, you know, bothersome enough that we go to the doctor for it. But it's a sign or a symptom that something is off balance. And if you keep ignoring it, it can turn into a lot bigger issue. And so I start there, but there's definitely other testing that you can do. You can look at comprehensive stool analysis. You can look for food allergies or food sensitivities, and that could be affecting your immune system. But there's a large link of, I mean, people have heard the term leaky gut or intestinal permeability. And when you start having, you know, signaling that's supposed to, you know, not go outside your gut, going into your immune system, that can cause a whole host of issues that you wouldn't realize are coming from an impaired gut barrier, like autoimmune conditions and skin issues, especially in, you know, kids who have really good immune systems. You'll have eczema or rashes and different things, then you might find altered microbiome or gut bacteria or food sensitivities that clear it up pretty quickly because their immune systems do respond well. You just have to figure out the root cause.
Yeah. I think there's a lot of people right now who are like, I have a little, like, I don't go to the bathroom every day and I have acne or I have rashes so explain to me a little bit of the mechanisms that are just like foundational, like layman's term, let's go 8th grade level here of like how a symptom like that, whatever symptom you want to choose would be common, could lead to something that we manifest and see on our skin. How about that? Let's just go, whether it's acne or rashes or whatever. Just link that together with the leaky gut. Let's like tile that together for me.
So if, things that cause an impaired, intestinal barrier, like our cells should be keeping food in and other signaling out, and things that can lead to leaky gut could be stress, toxins. We all know that we live in a more toxic environment than ever. Taking antibiotics, which sometimes we need, and you just get all these insults, and then maybe our body doesn't have enough nutrition or time to repair that gut barrier. So then, you're eating your diet, healthy or not, and that leaky gut barrier, you're starting to you love peanuts and you're eating them every day, and that signaling molecule is going into your immune system where it shouldn't go, and your body starts mounting an immune response, and you get this kind of, I guess this is maybe a little over 8th grade level, but,
no, it's good. No.
But basically your body is reacting to it.
Yeah.
And then you get a rash because of your immune system being disruptive.
Right.
And then what we can do is we find, oh my gosh, peanuts are a really high food sensitivity. And what we do is maybe we remove peanuts for a couple months, and we try to really support the gut lining and the gut bacteria, and the rashes go away and your immune system improves. And then side note, the kid is getting less colds because of the immune system being improved.
Yeah. And I love this because, well, you and I were both nutrition majors. Same place, right? You went further with it than I did before, but then we both go into medicine, right? And in that, there's there's a lot of interesting things that this food causes this. Like dairy contributes to acne or something like that. That'd be a really common one in like the dermatology world. But the way that you just framed it up, I think illustrates that even in an individual, with a food sensitivity, there can be variability in how sensitive you are to it based off of, well, many things, but what's going on in your gut, right?
Right.
So it's not all like X. It's not all causative. Like X leads to something else. There's other factors that go into it.
And I think sometimes people go through the realm of like, oh, I have 30 food sensitivities, and then they just stop eating all food, and they come in very weak and malnourished, and their mitochondria, their energy is not there because of all this food elimination, when really we just needed to heal the gut and help open up detox pathways.
And this is why you need somebody to help you interpret your tests. Right. You can't just order the blanket of everything available to you, get the information, and then cook for anything out of range. Because I will also say that sometimes, even when things are in range, you can play with other numbers to interpret them.
Right.
It's not just things that are up or high or low, and you're like, well, those are the things I need to work on. Sometimes you're like, nope, actually ignore those. Look at this thing that's actually in range. But
but has more of a lever on impacting your overall health.
Yeah.
And I think it's cool we have more direct to patient, testing available. But then it's, what do you do with that information? And working with someone to go through what's the highest priority in comparison to your health goals. AI isn't going to know that you have XYZ, and really you need to start here before you start doing some crazy detox or something that's going to make you sicker.
It's very definitive that it knows that, though.
Yeah.
It thinks it knows it. Yes.
I know.
Yeah. You mentioned detox a few times now, actually, just organically mentioned detox. Talk to me about toxicities, detoxification, common things that you see there, just whatever the toxin may be.
Right.
What should we be aware of?
Right. I mean, people are becoming more aware. Definitely there's heavy metals. We hear about mercury from metal amalgams or large fish. Plastics are a big thing right now, especially microplastics. There's a lot of hormone disrupting chemicals in skincare products, and people are getting more educated on it, but some people don't realize how all these artificial fragrances and chemicals could really be disrupting hormones and making it hard to balance. And that's where looking at root cause is so important, because I can give you detox pills, but if you're slathering on chemicals every day, it's not really improving overall health. But yeah, I think when I look at patients in general, I am always thinking about supporting our natural detox pathways. I mean, fiber is a natural binder. There's all these fancy binders out there, which I do use, but fiber's nature's binder.
Yeah.
And cruciferous vegetables are supporting liver health and detox pathways, pooping every day and sweating, the sauna and that type of thing. Is just starting with the basics. Lymphatics, people are becoming more aware of, jumping, dry brushing, and helping move things through the body.
Yeah. Well, you changed that for me in my internal morning bath that I do every day. I now add fiber to it, basically, because of you. So it's it's hydrogen water, and usually a little bit of electrolytes, and then poop. I start adding fiber to it, just that was a simple addition into that detoxification pathway for me. I want to pull two things out of that you just mentioned. Well, I think three things, actually. You talked about endogenous or intrinsic detoxification pathways. I want to know when those aren't enough, and then what kind of things you do. And then I'm going to ask you about endocrine disruptors, and I'm going to ask you about microplastics a little bit. But when you say, so can I just make my internal detoxification systems good and then just kind of not have to worry about it?
That's where you start, right?
Okay.
You want to start with supporting your natural detox pathways. And sometimes that is enough for people. And they've, limited their exposures. They have good detox genes. But what I've seen more often than not, doing a lot of genetic testing, is a lot of people do have genetic impacts that are impeding their ability to detoxify. And then the amount of toxins that we are exposed to just sometimes outweigh our ability to compensate for those. So in general, when I do toxin testing, everybody has toxins. So we can assume that there is some sort of toxin load. Now, is it causing an issue? That is a manifestation in both labs and in our symptoms.
Yeah.
So, I look at kind of the liver enzymes really closely. Are they at the higher end of normal? Is your GGT high? It could be an indirect way to show that you have a higher xenobiotic exposure. And then there's toxin testing. A lot of times I'll do urinary, mycotoxin, heavy metal, or environmental toxin testing too. And that way we can see how much of that could be impacting your system. And after those natural detox pathways are hit with lifestyle, then we can pull in maybe additional liver or mitochondrial support and binders that might be more specific to the things that we need to get rid of.
Which you did for me.
Yeah.
So another little personal story. I wear a continuous glucose monitor, and I knew my blood glucose levels very, very well. And then with one round, when I started wearing it, I was like, oh, this is higher than I would expect. And we sort of started looking weight's the same, exercise is the same, no reasons for it to be different. And you were like, well, let's look at your toxin load. And I was like, what? And long story short, mycotoxins was my thing. I still am not 100% sure where this mycotoxin load came from. You put me on a very specific binder for that, because I can't do much else for my endogenous detoxify. I can't exercise or be in saunas any more than I am.
Right.
I, got a great bowel situation. That was one thing you looked at me like, good, you don't need to do anything. I'm like, whoa, all right. But the binders, or I guess that detoxification for me in particular, changed my baseline blood glucose, which we saw in change in my hemoglobin A1C, and then what I see every day in front of me. And so that was just, I was like, oh, I cannot, another one. I was like, that's a longevity. Like, that's my aging. That's my skin health. That's my everything. It's like, simple thing that I would have never known. With me, you had all the information first. If someone was just coming to you de novo, like no information, would you look at their their genetics, their endogenous like detoxification pathway genes first, or would you rather see their like laboratory work first, or do you really need them both at the same time?
I usually start with lab work just because it's the most accessible, right?
Yeah.
So then I can take the big themes like, do you have inflammation? Do you have nutrient deficiencies? Is there a burden on your liver that we suspect? And then I'll usually layer in the genetics if they're able to, and then using the two together is like the superpower.
Yes.
But blood sugar and toxins is one that people don't typically think about. I had one patient that had pretty severe hypoglycemia. I even was like, maybe you should actually consult with an endocrinologist. It is dropping like super low, was wearing a continuous glucose monitor. And we did a toxin test as well. And I did like a simple like detoxification support. She already had the lifestyle things in check. And then I didn't hear from her for a long time, and I had reached out, and she was like, oh yeah, everything went away. My blood sugars are fine. So
yeah, there's some fun patient overlap with us there in that both of us tend to have patients who are already like pretty high performing, pulling the levers. I always say they're before they see me, they're doing everything. They're not like, oh, I'm just showing up on your doorstep. They're at a high level. That's how they find me in the first place. But it's the same with you. People aren't just showing up unhealthy. You have a lot of patients who are like overall doing a lot, and they care. Obviously, that's how they find you, because they care. And it's these like very individual things that I think makes your job significantly more challenging, because I know that I could pull somebody off the street and give them to you and you would change their life. But if you take the selection bias of the person who's already they're super into it themselves already, and then they have just thought, you just get the hard problems, the things that take a little bit more problem solving to get.
Definitely. And there's just more like complex chronic illness too. There's the people that have like seen all the doctors and seen, maybe multiple integrated practitioners that have a lot of like chronic inflammation. And that's really where you're having to do a lot of mind body and like very succinct like detox strategies at like certain times to really help those people, but it can be transformative.
Well, I'm going to ask you a question about what your definition of functional and integrated medicine are a little bit later, because that brings up a good, can you just lay that out for us? But I don't want to skip over the idea of, I think, two really resonant points here, especially in a podcast that, generally talks about like the face. How about that? Or physical beauty, or whatever we want to call that. You talked about endocrine disruptors. I just want to leave it at that. I don't want to lead down the cosmetics route, because it's not just cosmetics. It's fragrances and things like that too. I have your mom, young kids. I have young kids. My daughters love smell good things. And just like run us through, how worried should we be worried? I'm not trying to fear monger here, but should we be worried about that? I love Courtney Swan, who has this idea that, you're just going to have some exposures to toxins in your life. And you don't want to like bombard yourself with them, but you also can't completely avoid them and live a normal life. So do all the things you can do, limit what you can, but also like enjoy your life.
Right.
So should I just be letting my 10 and 9-year-old daughters enjoy their smelly good things? Which I don't, because I'm trying to teach them all these things. And any like normal parent, I don't even know what that means, that would see me as like, oh, like, yeah, you maybe get a small piece of cake at a birthday party, and it's 1 and over, and like,
there's
I'm already the weird dad, basically. I'm already the weird dad. Is like, we don't do those things. Like, why do we have to have that? They're not eating processed foods. They don't like all the things. And so, is this another one that I like? Food dyes, or we can get into all those things, but like, how does fragrance fit into that paradigm? Because currently I tend to be relatively like, I throw them away, much to their chagrin. I throw those things away when they're not looking. They usually forget that they ever had it, but it's not always the case.
Right.
Do I need to be that extreme? I know that we have some alternatives. I'm going to ask you what those best things are, but like, what do we do?
I know. It's a hard world that we
Right.
live in every day. Like, snacks after games and different things.
Right. Oh,
It's
yeah,
the
that's
whole
a good
thing.
one.
Yeah.
Yeah. That my kids are the kids who don't get the snacks after the
Right.
game. You are not
Yeah.
going to have goldfish and Gatorade.
We're gonna be
You're not going to
it's like,
happen.
can I have one sip of the red dye?
Yeah.
I'm like, no.
Nope. Right.
Yeah,
Yeah.
I know. But in the scheme of things, I mean, endocrine disruptors to me are a big one, especially for young girls.
Is it different for girls and boys?
Hormonal development, just with women having a little bit more complex hormonal, changes. I would say I would not want like a whole bunch of fragrances just being rubbed kind of all over the skin. Like now, I noticed the extra fragrant thing at the whatever we're visiting somewhere, their soap or something. I'm not obviously going to like bring my own soap. Some people might to places, but just kind of the day in and the day out, I think it's good to try to look for cleaner products. Definitely ones most are advertising, paraben free. Of course, there's other toxins out there. There's a lot of good, easy apps to kind of run through like lower toxin items. I think there's just a lot of opportunity to lower that toxin load. So I think it is a priority just from a hormonal standpoint.
Yeah. So you mentioned parabens. Are there any other I'm asking you for my knowledge too, almost everything is paraben free now that I would even dream
phthalates,
of.
And then there's all the things with all the long names that we'll never all memorize. So that's where I'm like, okay, let's check the app or use a product that's essential oil. I mean, I use a lot of
so there's our alternative.
Now,
Essential oils. Then what app are you using?
I'll do the Think Dirty, I think, app. I have like 5 on my phone probably, but I don't really use that many products on my kids. I have a lot of Primarily Pure. I use Baby Balm a lot. And
real simple stuff. Yeah. I like that because I wonder that all the time. It's everywhere. And I see it in products that are good products, like expensive. And I'm like, expense does not equate quality in these things at all, which is interesting when it comes to facial products or sprays. Like I just got back from a trip, and when I'm getting Ubers, I'm almost thoughtful about which Uber I book based off of what I know it's going to smell like in there, because I know that some are just notoriously like, these are the ones that have all the smell stuff in it, and it makes me sick.
I know. You definitely get more sensitive to it. I mean, I was like lathering on Bath and Body back in the day.
Right, yeah.
Love it, and now I go somewhere and I'm like, there's like an air freshener in here. And it's just like a lot. I mean, and I don't want to,
So is that air freshener disrupting our endocrine system? That simple. Is it? When I get in that Uber and I don't feel good, is something happening? Like legitimately, is that like affecting me?
It's one of those things where you can't like single out a one particular item. Like it's just like when people don't eat bad foods, but then they use their lotion, or they do eat some bad foods. I don't know. It's like all relative to like our exposures. And so it's just one more drop in the bucket. So it's like wherever you can kind of like lessen that,
minimize it,
and, function in the world. And
it's back to Courtney's philosophy.
Exactly.
What about, what's a worst case scenario? Someone's getting really, really endocrine disrupted. What does that mean for, let's use our daughters as an example. Like, what does that mean for our daughters? I guess it could be our sons too, but what does that mean?
So a lot of times there's a lot of like estrogen like mimickers. The age, I think they are even changing the age of like average menarche because girls are starting their periods so much younger. Now, can we pinpoint one endocrine disruptor that's causing it? Maybe not, but it is like the food, the chemicals, all these different things. And now we're kind of normalizing it rather than fixing the problem. And so I do, so many women have had terrible periods and cramps and, learning in the conventional paradigm, it's like, okay, well, we can give you birth control.
Yeah.
And that isn't, getting at the root cause.
Right.
And so you go down that route where you might have symptoms that are, disrupting your life, but then that can turn into insulin resistance, which can turn into a longevity issue. So again, all those systems are interrelated. And so it can be a big deal over time, but there's so many levers that we can pull and do. And, you don't have to do everything at once, right? Like I think it gets overwhelming when people see like, oh, you're not supposed to do this or eat this or take this. And it's like, well, what can I do? And so I think reframing it and like meeting people where they're at and just trying to reduce that load is where to start.
So I'm going to ask you this question in a few ways about a few different things throughout this conversation, but I'm just going to lay this out. So when I'm saying, if we go out a 30,000 foot view and we can see the whole spectrum of people's opinions or medical evidence on things, from the deep in the rabbit hole to the generally regarded as safe opinion, like, yeah, this is generally regarded as safe. Where on that spectrum, because the truth is not either one of those, right? It's not killing our daughters, and it's also not doing nothing. Where do you think like the endocrine disrupting types of scents or fragrances or topicals are falling on the spectrum in real life? If you were to just like kind of like have to, stamp your opinion on it based off medical evidence and what you see, like, is this like we should be worried, or is this like, it's just suboptimal?
Right.
Like, yeah.
I think that.
Or do we just don't, because one of these I'm going to ask you about microplastics. I'm interested to hear what you say there too. We just don't know.
We don't
but we know. That
that's a thing.
We know that it's not totally safe.
Right.
But I also don't know that it's killing everybody. Maybe it is, but we just don't know. It could be anywhere on that spectrum. If you were to narrow endocrine disruptors down, because from a sunscreen standpoint, we actually know that we know, oh, that wasn't good. Some of those are like very potent endocrine disruptors, and but those are like very distinct ingredients. Like you can point to that one. I know the names of them off the top of my head versus these. I don't even know what a lot of these products are. So where are we on our spectrum there?
I know that's a difficult
towards
one.
The crazy dad and mom, or towards the ignorantly blissful dad and mom?
I feel like I'm above half.
Okay.
But maybe not like at the very top. But that's just my personality is kind of moderate about everything, just because I know there's just so many different
which makes you great at what you do.
Yeah. But yeah, it's something that I think about, but I don't scare people about it.
Okay, so on to microplastics then.
Okay, yeah.
Because this is one too that I think we've never talked about. Everybody gets to see our first conversation about this directly. I went through a big, hard try to get microplastics out of our operating room, and that was challenging, expensive, onerous. I think my staff so greatly because they have to order special things now. It's like that embarrassing thing when you go with somebody to lunch and they're like, "Do you have any food allergies?" And they like list 79 things, and you're like, that's me now in the operating room, basically. Like, you can't this, can't that, like all the restrictions that come with it. But it was kind of what I would want, and not kind of, it was what I would want. That's why I did it. And I went on this like, okay, how important is this really? Like, we know that we're accumulating them, strong to like, there's evidence to show that unquestionably. But what's it doing? What do you see with it? Where are we at on that spectrum? What do we do about it? Besides not getting it when you're having surgery with me, like that's a huge reduction, and it's not embarrassing because you don't know what you don't know.
Right.
But when I look back, I'm like, yeah, everybody that was getting an IV or getting surgery was getting exposed to a lot of microplastics, even by me in my career until I knew what I know,
Right.
How do we manage all this? What's your opinion on all this?
Yeah, I feel like there really isn't a ton of data out there. There's not even a really good way to test it that I'm aware of.
Yeah.
I mean, there's
some blood
just certain
tests for it
elements.
now,
but
you can search for PFASs now.
Right.
Yes. Exactly.
Yeah, like some of the specific elements, but the micro, like that level of plastics, we just don't know as much about. So I put it in the bin of toxins, and actually, I think there maybe was a study related to like fiber reducing micro.
Oh, interesting. Because it's accumulating in organs. Like the famous one was like, oh, it's getting in your testicles. That was like a big guy one. Like, what's that doing? You know?
Right.
Like, is that causing microinflammation that's changing your testosterone levels or something? I mean, do we know anything about that? Or is this just on the spectrum of like, we know it's not good, but
how much is it impacting us, and what can we do about it is reduce our known exposures to plastics the best that we can. Like, don't have a plastic water bottle as your like everyday water bottle, but then when you like go to a conference or travel and it's kind of like, you look at ewg.org and your the tap water database is
not great either.
Not great. So it's all part of that spectrum. And I just can't like overly emphasize one thing because there are so many things that impact our health. And
Yeah. Yeah, that's kind of where I'm at with it too. Like, but I found a very obvious exposure, and did my best to get rid of it for my patients at least. Yeah. Let's talk about hormones in general. We talked about endocrine disruption, but what about hormones in general? That was another area that you mentioned. We've talked about detoxification. We've talked about the gut a little bit. And you mentioned hormones. My approach to this and my lens has always been, and medicine has been on quite the roller coaster with this over the years, right? But this isn't something that I directly control with my patients. Like if I have somebody who does or does not want to do hormone replacement at whatever age, I'm literally staying out of it. But I do get to observe then how different people age. I get to observe how they recover from procedures. And I get to, I would say that and their longevity of their procedures are noticeably different in different phases. So men and women, really. Where are you at on this? What should people be aware of?
I think hormones are essential to longevity. I really do. But I also think, I'll say it over and over, I'm all about finding a balanced approach. But especially like perimenopause to menopause transition, I think hormone replacement therapy can be really, helpful for that longevity purpose, for quality of life. But I think you have to look at the full spectrum. You have to look at gut. Gut impacts the way we metabolize hormones. We have to look at cortisol, adrenal, stress health, thyroid optimization. And so it just, there's a lot of like hormone clinics that mostly focus on like giving hormones, but I think that having that full spectrum approach, especially, both men and women, like testosterone for men especially, it does have a large impact on brain health, cardiac health, and those big things for, aging well and preventing chronic disease. It's just being able to have a balanced approach to it to support longevity and not miss out on those other systems that need to be optimized.
Yeah, it's good to hear you say that because I hear this, I work with a lot of women, right? And something that I deeply am curious about and understand, but also can't relate to, right? And this idea of this perimenopausal time frame, which honestly in my head is a widely massive range of time. It's not like,
Yeah.
I'll have women say all the time, like, I feel like I fell off a cliff in their aging. They're talking about what happens with their facial aging. And I'm like, well, there's an underlying reason for that, which there's definitely more precipitous changes in our hormones, but the actual delta, the change in them happens very slowly over time, right? So if somebody's in that perimenopausal phase, but they're earlier on, and that they know it's coming, but they're not actually, near going through menopause yet.
Right.
How do you handle that with a young, someone who's just early on in the do you go to replacement early? I'm asking, and for a woman specifically, I'm going to ask you the same question for a guy. Do you go to replacement early? Do you have other methods first? How long do you give them of let's just call it lifestyle or other types of changes like stress management? How long do those take? Are there natural ebbs and flows that you might have just caught somebody at a low point? How do you manage all that?
It depends on, what symptoms they're having at the time. A lot of people, by the time they come to me, they're having symptoms, right? They're having insomnia or night sweats.
How old is that woman?
Probably 40s.
Okay.
Sometimes late 30s, you'll start to get some changes, but earlier on, I can pull the levers of obviously I'm always looking at lifestyle and those foundational things like sleep, right, is essential. But if you have low progesterone and you're not sleeping, that is going to be life-changing and over time really helpful for overall health and longevity. I use progesterone a lot early on in perimenopause. I use estrogens a little bit less because until later on and getting more low estrogen related symptoms, and but then always looking at kind of gut health and all these other things that we've talked about to make sure, because even people come to me on hormones feel imbalanced, but maybe we haven't optimized like adrenal health or their general nutrition status. So
Yeah, there's a lot going, like especially for females. There's a lot going on there. It is a balance. You said balance, which I really like because there's feedback loops in there. And what about the ebb and the flow idea? Do you like tend to follow people for for some period of time before you really start making determinations about whether they need replacement, or can you get a snapshot of a lab and be like, yeah, we got to do something about this?
Yeah, I can definitely get a snapshot, but not even of a lab. Really, just like where they're at in their hormonal journey and their symptoms.
Okay.
I mean, I think I will, I mean, not always, but I can start people on some like low doses of progesterone therapy at their first visit if I feel like that's the right fit. And I also want to meet people where they're at as far as what they're open to, what they feel comfortable with, give them the education that they need. Obviously look at risk factors and cancer screenings and that type of thing as well.
So that the segue into my next question is for that 40-something your old patient who you're talking about, progesterone, like starting low, what do you talk about as far as like things they should be concerned about? Safety. Is there anything that really is like, this is important to talk about?
Right, definitely. I mean, you don't want to give hormones to anyone with active cancer, obviously. Right. There's hormone receptors, and I think just knowing that like if you were to have cancer or like a breast cancer, I tell women, and I gave whatever hormones you are making that I give you could cause that cancer to grow in size. It's important to stay up on cancer screenings, whatever that looks like for you. And then, estrogens can sometimes play a bigger role in some of the risk factors and DNA damaging metabolites as far as cancer risk goes. And so, there's a lot of things that are nuanced and that you have to keep in mind from a safety profile where, there are a lot of people that come what I feel like way overdosed on hormones and maybe not making sure they have that safety profile too.
Which is the perfect segue into guys. Because this is my world, right? I have never done testosterone replacement, and I am in a world of like jujitsu where I am like highly competitive as a human, and it's hard for me to find people in my like age who I could grapple with, where it's almost like a level playing field. Everybody's I'd say super physiologic. That's my word. They're on T, and you just like there's no way that this is real, or and it's not even that it's not real. How about that? Because it is real. Is it the same situation with guys where, is it the same ages? Is it the same sort of symptomatic treatment? Do you need a snapshot of labs? Do you give it time? How does all that work?
Right. I definitely look at labs for men and symptoms. I actually see lower and lower testosterone in younger men, even in their 30s. Stress, stress, chemicals, all of these different burdens.
Yeah, right.
Heavy metals, toxins, environmental toxins.
Yeah.
Right. But
have you seen people treat like a toxin that showed up on a test of yours and had their testosterone change meaningfully based off of taking care of a toxin?
I mean, I do things simultaneously, but I definitely have seen endogenous testosterone increase pulling lifestyle and detox, like measures. So, but, when we get into testosterone replacement therapy, it's just an important conversation. Like, are you supporting like endogenous testosterone production? Do you have enough zinc? Are you strength training? Yeah. And then if you're on TRT, you're dependent on it because it, shuts off that production. And then you're looking at kind of the downstream metabolites. Do you have higher estrogens or DHT? Related to like hair and these things. But I've had men come with really, the blood can thicken and, they're like, oh, my doctor said that's okay. And I'm like, no, there's definitely cardiovascular risk factors there. So
I kind of mentioned that because I see, and I've talked about this actually before, with a lot of heat, I will say, or a lot of like strong opinions about it. And there's, we were talking about how I love cognitive biases and understanding why people react the way they do or make the decisions that they make. And there's a lot of just like self-protection involved. Somebody's already made a decision and they have a confirmation bias towards that. But I see at some point more aging-related changes in faces with patients who are on testosterone replacement specifically. It can cause some changes. There's some aspects of things that get better and some aspects of things that get worse. And overall, it creates sort of a signature in somebody's face. This is, I think for a lot of people, it's hard to explain, but you know it when you see it sometimes. Like there's something up there. But you don't exactly know what it is. It may just be like the vascularity of the skin changing. Like, yes, maybe the skin's stronger, but the vascularity changes, so it makes them look older, actually, People don't love that, sort of statement, but it's true, and it's my observation, and it's real, and it's based off science and based off of how our brain perceives the face, neuroanatomic changes. Yes, you can argue about the structural strength of the skin, but when the rubber meets the road, it doesn't look as good, right, to our brains. But I tend to find that I'll have patients who come in and they are very, 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 very super physiologic. This is common, or people that I know, or athletes that I roll with, or whatever, because, and I've experienced this too, where you just like, if someone were to ask you, like, do you ever like feel like you're lacking a little motivation, or and I see, I don't know, I'm not trying to like single out clinics or something like that, but people that like, you could convince any guy that they're low T, like literally any guy. What happens? How does that work? I have this in my head that, and you might change this for me a little bit actually, but I have this in my head that anything that is anabolic and builds you up is also borrowing from your total lifespan. Is that true? Should I be thinking that way?
That's a good question. I guess it just depends on what pathways it's going to impact long term. If you
on
have
a
high
very simple level,
cardiovascular risk, and you're.
You were just kind of talking about like brain health issues. On a very basic level, let's just get simple with testosterone, is being super physiologic and feeling like, and I hear guys talk about this, like, oh my gosh, my sex life, my erections, my workouts, my motivation, my mood, they all elevate. Like, I feel like a young man again, basically, right. Which, you feel like a superhuman. So why wouldn't everybody do that? Unless there was a downside long-term even. Right. And so I'm asking, does that exist? Does that tie there? Or are you saying like, oh, the brain health benefits of it are so good that, you should probably, if you have these symptoms, you should, because that's how some people think, right? Like, if you're even like mid-normal or slightly higher than mid-normal, well, we kind of want that like right at the top or supra. Is that okay?
I think you have to look at the whole picture.
Okay, well,
I always want to, and that's the thing. It's not that I don't want to optimize testosterone, because I do, and men can feel incredibly a lot better, And I have so many people that are like, I need 1100, or whatever the lab value they're shooting for is, versus like how they feel and what else is going on in their system. If you have a testosterone that's 1100, but your estrogen's high, your DHT is high, your red blood cells are high, your insulin, you have prediabetes. Like, is that pulling a positive lever? Not necessarily. Like,
well, you feel great.
Right. So I think it's just being able to stratify risk and longevity, looking at the whole picture and not just one thing. And, I'm like, I don't like the idea of chasing a total testosterone level, because everyone's different.
But everybody
and then,
knows.
Your free testosterone is your active testosterone. What does that look like? Right. And so it's
like a thing now. Like,
it is,
in my age group, like, I could probably ask half the guys at my jiu-jitsu gym who are 40 or over, and they probably know it off the top of their head. It's like a thing. So it's become part of this, I don't know. So you have a guy who's 60th percentile, say, like, not low, not high, 60th percentile, but they have symptoms that, you're like, oh, your testosterone, and all of their other lab values are super strong. Are you going to replace that guy?
If he wants to, I would start with maybe natural supports and
what does that look like? Yeah, that's a great.
Yeah, exactly. But I think that there is certainly, just like I would with women, that area of optimization when you have a lot of your lifestyle stuff in check. There could be.
Okay, so let's run through both those scenarios. That guy comes in, great, like solid lab work overall. Has like maybe a couple of like lipid things that are like, well, this could be a little bit better, but overall you're doing great. 60th percentile, but they're like, I just kind of feel, I'll fill in the blanks, all the things. I feel a little lethargic. I don't feel as motivated. I don't feel like I have as much libido, blah, blah, blah. And they're like, and I want that to be better. Okay, what's the first thing you do with them?
Besides, like after their labs?
Labs are in and everything's, they're like, their vitamin D's okay, and they're eating cholesterol, and they have zinc and all the things, right? Because you're going to do cholesterol, vitamin D, and zinc, right? Those are going to be supplements that you got to make sure those are good first.
Right. And then discuss, I mean, are you interested in testosterone replacement therapy?
What if what are you going to go right to that? Or are you going to have them do, what lifestyle things do you have to do first?
I mean, strength training would be at the top of the list for sure. So
lift heavy things?
Yes.
Should they grunt when they do it?
Preferably.
Yes. Yes. Send them to jiu-jitsu with me.
Right.
That'll
Exactly.
help,
Maybe just absorb some testosterone from
right.
the other guys.
That's
and
actually a good point. I never thought of that. I never thought of that. Anyway, go ahead.
But I think that it's reasonable. It can improve quality of life for sure. If they're symptomatic, that's the thing. Is I'm not just going to. I'll never just treat a lab. I mean, I guess are labs that are like bigger things longevity wise. But as far as hormones go, I'm not always going to just treat a lab. I need to have that correlation with symptoms and body function with that. But I think it needs to be done, in some areas, like people are not replacing enough and like supporting optimization. And then on the other hand, we have people like way over shooting, I think, hormones, where sometimes even people come to me and are on high doses and have negative symptoms, and we've lowered their hormones and they feel better. So just being aware.
Yeah.
Kind of all the parameters.
And for you, that sort of, is it testosterone alone? Are you ever using like growth hormone for guys and things like that too?
No, I'm not. I know a lot of people are, and there's definitely, I would say, tend towards more the growth hormone supporting peptide therapies.
Right. Yeah. Interesting. Well, so you just mentioned peptides a little bit, which I think we're going to see a lot of changes around the regulations with those here. I mean, it's actually, we're seeing it right now. I shouldn't say we're going to. It's already happening. Because I have a lot of patients who are on peptides of various forms, and I like it, honestly, when they are, because I see differences in their healing and how that gets supported. And the growth hormone that we just talked about is one. Again, I kind of take the same avenue with growth hormone when it comes to peptides, because there's certain peptides that are very good for soft tissue healing, right? And you taught me a lot of those. But when it comes to the growth hormone ones, if they're on a growth hormone or ghrelin mimicker, I'm like, well, you're going to have a great recovery, from this, but I'm neither stopping nor starting them on those things, right? That's kind of coming from somewhere else usually. And so we could do a whole podcast just on peptides. We'll probably wait for that to change, the things to change, but GLP ones are a peptide as well, essentially, right? FDA approved, have uses. I know what I see with them, pros and cons, right? I think some people think they should be in the water,
right?
And others, like I see some of the downsides of them. And not that to say that does not mean that the benefits outweigh the detriments, but I see the detriments often, which is, I had a 40-year-old patient last week who had some genetic predispositions, but ultimately she's like, once I kind of started on a GLP-1, like all these things got better, but I really noticed this change in my face.
Right.
So she would just do it again, but now what do we do about this? What does your use and landscape with those look like? Are you on they should be in the water? I mean, or is it, because there's this part of me that kind of wonders, like, I know the answer, but is there anything they're doing that I couldn't, the patient, or, that I couldn't do with, like discipline and like, all the hard stuff? Like, are they actually doing something special and unique? Are they pulling a lever that I can't otherwise pull? Is that?
It's interesting. I mean, I think no, I don't think it should be in the water, but also I utilize them frequently.
Yeah.
I think the brain piece,
Talk about that.
like limiting the effect on neurons in the brain as far as, people equate it to like not having that food noise anymore, is different than trying to do CBT for that, or, it just, that has not historically worked really well.
Yeah.
I think when you have a little bit of that insulin resistance, which a lot of people do, or prediabetes, and hormonal changes, especially in perimenopause, we can only do so much. Your hormones are going to be shifting no matter what I give you. Then it can be a big game changer in the way that people feel and the way that they respond to their lifestyle measures. I rarely do full dosing, and I emphasize, macronutrients and strength training. But, there are people that are just kind of chasing, the weight loss without looking at the whole lifestyle measures, and that's where you get, I think, more of the negative effects. And at other clinics where people just maybe prescribe it and people are not eating and not being tracked for those key things. So I think it's changing medicine in a big way, because we have so much chronic disease based on
Related
like
to
metabolic
that.
disease.
Yeah.
But then I'm wondering, like, 10 plus years from now, what will the landscape look like as far as mortality, related to like hip breaks and malnutrition. And I'm just curious what that might look like for people.
Yeah. Yeah.
And lack of muscle mass and
finding the balance of those things, right? Yeah. That's really interesting. I kind of wonder those same things in my world, right? And if people haven't picked up on this, there's both you and I tend to function with like pulling a lot of little small levers instead of pulling one big lever really hard. And in my world, I see that all the time, and it leads to bad outcomes and disaster. Like, I'm going to do the one thing, I'm just going to go for it, right? But GLPs would be that thing. Like, there's a lot more elements than just that one thing in it, which is, I think, where this, like, the microdosing is coming in, right? It just becomes one small lever and a series of other levers that you should be pulling at the same time with your nutrition and your exercise. And then it becomes my job to figure out if there's a way to mitigate the facial aging part of it, really, because it's hard to. There's no like magic bullet at this point that will stop that part of the whole equation, even with the other levers getting pulled. Is there anything? And I asked you this, but I'm going to ask you directly. Is there anything special about it that can't be done another way? And I'll just give you an example of a friend of mine who is, very fit, very active, very beautiful, very, like the total goals, right? In her 50s, say, and that microdoses of GLP, and sort of I'm like, why are you doing that? What is, and her like internal opinion on it is that there's some aspect of what it's doing that it's adding to the, she's pulling those other levels. Let's just say levers perfectly. Let's say she's pulling them perfectly, which nobody's actually doing, but she feels like, like I can't imagine what you would do any different with your diet and your exercise and your food choices. Is it adding something at that point anymore?
It depends.
Like should I be, I'm not on one, but should I be on? I can't imagine doing more than I do, but like, would it add something to my life to be on one?
I think that's where I'm looking at.
It's not weight loss and stuff, but just like metabolically, is it going to add something?
That's where I'm looking at more like your insulin and your blood sugars and your liver and different things, because I think there is a place where it maybe is just because of the risk of cardiometabolic risk factors. But I'm not at this point putting people on them like prophylactically. It's more like, but so many people have insulin resistance and visceral fat and different things that I think can be improved. With that said, I also have people, not on GLP-1s reducing visceral fat and gaining muscle and, doing the other things that we've talked about. So
Yeah,
I don't think it's a must, but yeah,
I
it'll
like
be
that
interesting.
perspective. Basically, I read that answer as like, well, you got to look under the hood a little bit and see what else is there, because it's not just like what would appear to be like what you see from the outside. I like that answer. What about, you just mentioned decreasing visceral fat. Like, what is she doing, or what would I be doing to, you're saying decrease visceral fat? Like, what else could I do?
I think,
you know, is that the answer? The GLP can help me reduce visceral fat in a way that, like, you're not, I can't do anything else really. Is that an answer to help that?
I think the biggest lever, again, it would be like strength training, high intensity interval training, the right diet. And there are genetics where people are unable to lose fat as well. That's like one of the things that we look at in the genetic markers and some people's fat are more prone to inflammation.
Yeah, right.
And so that has an interplay with
If somebody has that
health.
genetic predisposition to have trouble losing fat, did the GLPs struggle in that person at all? Or is it, because it's not, it's appetite dependent, right? So it wouldn't matter at all.
You know, I have a lot of patients that I feel like are doing the right things and have kind of a weight loss resistance. There is some genetic components, and the microdose of the GLP-1 does make a big difference in body composition changes. But then I also have people, you know, cranking up their GLP-1 and things aren't happening, and I think we're missing something else, you know. Then I'm looking at the gut, your detox pathways, your hormonal balance. And we also have to remember that fat holds toxins. So, you know, if people are losing weight rapidly and releasing toxins, they often feel sick and can be harmful to their health too.
So fat releasing toxins is that like unquestionably established? We know what the toxins are. Do you see fluctuations in people's like toxin loads when they're in like a massive weight loss or when they start a GLP? Is that like everybody should be checking on that? You start a GLP, let's make sure we're watching your toxins because we know that X, Y, and Z tend to go up. Is that a...
I don't necessarily, I'm not testing, it's just more like symptomatic. I think the same, you know, symptoms that people have with, you know, elevated toxin load, it might be heightened when they're losing fat rapidly. I tend to try to think about liver, either natural or supplemental, and bile support when people are losing weight just for that purpose. But as far as like the true fast, like hard science. It's more of like that pathophysiological.
Are there fat soluble, like specific fat soluble toxins that we're concerned about or something? You just mentioned the liver. I'm going to get really nerdy here for a sec. So, well, no, because you're talking about weight loss and how it affects the liver. If you like have a patient who, I don't know, like loved high fructose corn syrup or something, and so you know they've got fatty liver disease. Like, not that everybody with some, but like let's say something very specific, like we know that fructose is directly changing that. Do you have to watch their liver different when they start losing weight because you know that their fatty liver is going to change more than maybe somebody who didn't have as much fructose before? Is that a thing?
I guess I'm always thinking about the liver or just detox pathways in general. And when somebody already is prone to like an impairment in their liver function, then any extra additive to that could impair it further. You know, people will have, you know, higher liver enzymes easier than others. I mean, common with viruses or different things, but there's certain people, I think probably some genetics play a role in that, where I'm like, oh, something just happened. Like I just had a patient today, had like a cavitation worked on, and her liver enzymes had been normal prior, and that was in a lot of immune system disruption. And then, you know, her liver enzymes changed, and that is the only thing we can think of that was different when the onset of her symptoms happened and the change in her labs. So,
from the procedure itself, you think?
Yeah, I think maybe just
the anesthesia,
kind of trauma of the procedure. I don't know what's happening when you're like trying to clean out infection and what's being mobilized. A little bit of Tylenol probably for pain, and you just kind of add in some of those layers too. So, but more than just the liver enzymes, it's like the way, like kind of some of those detox symptoms that pop up.
Talk about toxins. Okay. All right. I'm going to go and do some, I'm making these up off the top of my head, these rapid fire questions. I don't know. They could be as rapid as you want. What would be with most of your patients coming in, if you could just pick probably the most common thing that you wish people knew coming in to see you, or what's the most common piece of information that people even leave with after seeing you for the first time? You're like, that's going to be really valuable to you for the long term that you maybe didn't know before. What would that piece of information be, do you think?
I'm going to say nervous system support.
Oh, okay.
I think I always try to hit on like mindfulness, meditation, breath work practices. I always talk about like, I mean, even if you're just running around, taking kids places, like pick a breath, 4 seconds in, 6 seconds out, breathe through your nose, breathe into your belly. And as you're like driving around, do that breath. And there are people, so many people that just add that little bit and they feel better.
Yeah.
And, you know, put your feet up the wall. Like, I think that we miss that a lot. We're like, take more, do more. But sometimes, you know, we just need to like calm our nervous system down. Yeah.
That's interesting. There's a mountain of medical evidence behind that what you just said, that has mounted more lately too. I mean, that was what you just said. If we talked about it 10 years ago, it would have been like a little like, oh, it's a little granola, hand wavy. There's like hard science behind it now. And if we go back hundreds of years, people have known this forever and ever and ever. But it's just funny that it takes us that long to kind of catch up to that. Because yeah, speaking of hundreds of years, like we're built for a different environment than we live in, you know, very much so.
Right.
So I like that.
It's ancient medicine.
It's not what I was expecting you to say.
Yeah, I know. I was like, oh, the top 4 supplements. But no, I think nervous system. And, you know, I love like the research that Heart Math has done about bringing like your heart and brain into coherence, largely through just like calm breath work and gratitude practices at the same time. You can actually see yourself get into coherence and it can improve your HRV. So
there we go. I guess the metric. So what does your practice for that look like?
Usually combining like a calm breathwork practice with some sort of gratitude practice, like thinking of a person, place, or thing that you feel grateful for and like feeling it in your heart space. You know, they have like an app, they have their inner balance device. You can like try to see if you're in coherence, but in the simplest way.
You don't need the app and things to do it. You can just do it yourself.
And I try to just do that, you know, like in between patients, like, you know, like thinking something I'm grateful for, kind of clear out, be prepared for the next patient.
It's interesting. There's some research showing that versus because I tend to do that, like here's the things I'm grateful. I like to do that anyway. But to really mimic the being grateful, to like mimic that it's more effective generally to go back to a situation where you felt grateful or made somebody feel grateful, like where there was an actual exchange of that emotion, and try to relive those moments, interestingly, to get the actual like benefit of it, versus just like thinking of, you know, like a list basically, because I think that's what a lot of people do. But you sort of like hinted at that, which reminded me that it's like actually better to like kind of like relive moments.
And like feel it.
Yeah. Where you felt grateful, or you very clearly like, I could see someone else feel grateful for something that I did, which is apparently, I think, even more powerful than my own personal feeling, because it's like the things that I can tangibly read in somebody else. So it's kind of interesting. Okay, I like that. Because nothing should actually be, but if you could put one thing in the water, what would you put in it?
I'm going to say magnesium.
Oh, okay. Let's go into that. That's a good one. Okay. Which type of magnesium?
Just some sort of chelated, clean magnesium.
Yeah.
I just see that, you know, so many people are low kind of in that intracellular magnesium. It's involved in over 300 functions of the body. And it's hard to replete. I mean, people will take magnesium every single day and their red blood cell magnesium level will only go up like this much, but they're also stressed and they're working out, and you know, there's all these things that we're burning through, and we can eat more nuts and seeds and leafy greens and different things, but as far as getting the amount that we need from food and the soil, it's just it's difficult. Usually that would be like a supplement that's kind of a top one. Interesting.
Yeah. I use magnesium sulfate specifically because there's lots of different types of magnesium, and it's interesting. I think it's, I just think it's very interesting. I'll just leave it at that the different types of magnesium tend to have different CNS effects specifically, like different effects on our brain. So the magnesium sulfate that I use is reducing my anesthesia load, has a bit of an analgesic effect. It's incredible, you know. It eases the transition out of surgery. I actually use it towards the beginning of surgery. But that's different than, you know, citrate and threonate and all the other types that exist. It's very specifically mag sulfate. Yeah, so that's interesting. That's also not what I thought you were going to say. Magnesium. Okay, now I got to come up with one more. If you, for your same patients, so I've asked what they should all be taking, essentially, what piece of information they leave with from you, like the most important thing in general. What's the one thing that you feel like if you could like just blanket stop people from doing in your patient population? Like this, I see this like, you know, obviously, don't eat processed foods. Let's not go with something that basic. Right. But like, I see people do this, and it's a mistake that they probably didn't realize. Everybody knows they shouldn't be eating their bag of Doritos or whatever.
Right,
like, not to pick on Doritos, but like, what's the thing that you see that's like, I actually didn't even know that, like, or like, oh, really? I didn't. Okay. What's the thing?
Dang. The thing?
A thing, not the thing. A thing that's like, it's just common enough that's like,
well, now I have like the plastics on my brain. It's like when we get a hot coffee.
Yeah, okay. That's
like,
a good one.
Take off the lid.
Okay.
Or pour it into your mug or something, because we're just eating the hot drink and through the plastic lid. So
that's a good one.
Yeah.
Because I think a lot of people don't think of the paper cup as having microplastics, but it does.
Well, yeah. There's lining and lid and all the things. But I always think
lid's often black plastic too. Yeah, which is... but it's in there.
Right.
And you just mentioned, I think with that is like heat definitely changes. So like, and this is the issue with water bottles. Like you have no idea how many times they've been heated up and cooled down in this process. Yes, it's cool now, but was it sitting on a truck in the heat or whatever? So we like glass for that better. But in my operating room, this was an issue too, because we'll warm IV fluids before we give them to them. So I was just like, once I started figuring, I'm like, oh, we're warming it, you know, or things that are lipid-based liquids or anything, but lipid-based liquids for me tend to pull more of the phthalates or whatever out. And then one of the anesthetic agents that I use is in a lipid base. So I was like, dang it, warm, lipids, all the things. And so the container matters. What's in the container matters, like how quickly you drink it. But yeah, I like that one. No,
simple.
Think of your coffee cup and try to use your own if you can. Right. Or I've seen some places that have like semi-disposable type of like clay cups. It's kind of cool.
That's cool.
Yeah. So maybe we'll see that change. Yeah. I'm going to tap into your expertise here a little bit about the hormone replacement and just educate me a little bit. When you're talking about progesterone, estrogen, testosterone, they come in a bunch of different forms, injectable and oral and topical. What are your preferences for these? And do you have like strong feelings about why?
Yeah. So for progesterone, I typically use oral progesterone. It tends to have a little bit more sedative effect as far as like improving sleep.
Okay.
It also protects the uterine lining, especially with estrogen therapy. And then estradiol or estrogens, I typically do either in a cream or a gel or a patch.
Okay.
The transdermal estrogens I tend to lean towards. They metabolize less into those potential harmful metabolites versus oral that's going through your liver and potentially creating those. And then testosterone, typically a cream or an injection.
Gotcha. How do you make that preference?
Well, it depends on the dosing and the person, if they are willing to do injections, and then tracking labs. Like some people, I will start with transdermal therapy, but if we don't feel like we're getting where we need to go, then we'll change to the injectable form.
Yeah. What about women on testosterone? We didn't talk about that at all. How does that fit in with you? Yeah,
I definitely utilize it if I feel like there's a need for it, it's symptomatic, and I will look at the precursor like DHEA as far as to testosterone and estrogen. Sometimes I will replete DHEA and treat adrenals, and I'll see testosterone actually go up. And then sometimes I'll utilize a little bit of a transdermal gel for that. I have less women on injectable, not to say that that's not a reasonable thing too, but I mean, less needles in general, people like better.
What about pellets for hormone replacement?
I don't do pellets.
Okay. Why?
Because I tend to see pellets be prescribed in super physiologic levels. And I see patients with the negative effects of pellets where, they get maybe an initial good response and then start having negative effects because their levels are too high or imbalanced with their other hormones. It's not as easily titrated to meet the person where they're at. And so they can be done and they can be great for some people, but I don't do that.
Why do we see them everywhere?
They make a lot of money and they keep people coming back. Not to say that you don't want good follow-up with any hormone replacement therapy, but there's definitely like a marketing piece of it. Again, some people do great and it's a good...
Because you can get people where you want.
Right.
Titrated, basically. Yeah. Mm-hmm. Is there an element of addiction's not the right word, but we'll get what that is. Is there an element of like this physiologic addiction to being on something super physiologic like a pellet?
I've seen it in patients where they do, get that initial effect. And I feel like they're chasing that effect. And it's not because they need more testosterone. It's because they need balance in all the other areas.
Mm-hmm. I see. With women on testosterone, does it fall in a line? You were mentioned sort of like progesterone first. Is it generally, do you have women that are just on testosterone, or does it tend to be prescribed with progesterone, or how does that work in your practice?
Testosterone is kind of on its own term, and I usually very much base that more on labs. And I do test progesterone and estradiol. It's just that those are fluctuating so much more. Yes, you can test it on a certain day, but if men's periods are irregular, then you're getting kind of less of a key point to look at whether those are imbalanced or not. So then I lean a little bit more on symptoms for those. Yeah.
So what about birth control for non-contraception purposes? Not to not have a baby, but just simply for medical reasons. You sort of brought this up earlier. Is that something that you ever do?
No.
No. Why?
I like to balance hormones, and using the synthetic hormones to me is just a Band-Aid. It's not getting after the root cause. And so a lot of times it is a diet and lifestyle in young women, and eating the right foods and getting enough sleep can really help their hormones. I do use nutraceuticals or supplements to help, like herbs to help balance hormones, and that seems to work really well. But I just think that there's a lot of things you can do from a root cause perspective without the negative effects of birth control affecting your microbiome and, other hormones. And a lot of times too, people get put on birth control for non-birth control reasons, but then have, other side effects of hormone imbalance.
Well, you just said, you talked about synthetic hormones inside of the birth control pills. It leads me to the question of, when people are talking about bioidentical hormones, what are they talking about? What does that mean? Is that different than birth control pills?
Right. So obviously all hormones that we're getting exogenously are synthetically made, but bioidentical meaning in the chemical structure or form that our body would naturally make it. So progesterone's super important for overall health. And I see a lot of women, even, perimenopausal, postmenopausal women, on progestins instead, and they are still very symptomatic. And we change that to the bioidentical form, and then that often relieves symptoms. So I think that form can make a big difference. It also does change risk profiles too.
Yeah. Why would anybody ever be on a synthetic versus a non-bioidentical versus a bioidentical? Why would that ever happen?
It's typically from a birth control that kind of turns into like a hormone replacement therapy.
Morphs over.
Yeah.
I see. Gotcha. Okay, so I'm going to switch gears to a little bit of a selfish question for you here, because I love, in my nutritional world, I love to prepare my patients. I call it like pre-covery, prehabilitation, basically, before surgery. I love to get their diet dialed in. And that means a little bit different for everybody. I don't have like you have to go ketogenic or you have to go paleo or Mediterranean. I actually kind of work with what they already have and then try to optimize. And you've helped me with this before. What would be your pearls for either like foods or strategies or this like idea of an anti-inflammatory? That's what I really want, is like to have their anti-inflammatory environment optimized before they come. What are some of those simple things that people could think about if they're having surgery somewhere else, or what does even anti-inflammatory diet mean to you, a nutritionist in this world too?
Yeah, I think anti-inflammatory first is removing inflammatory foods. So trying to get rid of processed foods, excess grains, sugars, seed oils, which equate to processed foods. And then you want to like build the the nutrient density of your diet. So eating healthy fats, grass-fed beef, wild game, wild fish, extra rich foods and like polyphenols like berries and pomegranate, dark leafy greens, even dark chocolate or green tea, that type of thing. So getting rid of the inflammatory foods and then bolstering the nutrient density of the foods you are eating.
Yeah, I love to have my patients eat refrigerated fermented foods, like low sugar fermented foods. Let's just say that version of it. What are your thoughts on that? Like, what is that? Is that strategy futile for me? I mean, I have reasons that I like to do it, but what are your thoughts on that?
I mean, fermented foods and doing a variety of them really can help your microbiome, right? Diversity. It's all about diversity.
This is my gut lever.
And function.
Yes.
Now, I will say there are, this world where people are more reactive, genetic components where you might be more reactive to fermented foods because of histamine issues. So that is one area that I'm cautious of because some people are a little bit more prone to that sensitivity. But in general,
what do they look for in that?
Getting reactions from high histamine foods like the fermented, vinegary foods, maybe flushing or hives or headaches or nausea, some different things. I see a lot in genetics. It's kind of interesting to be able to correlate histamine and inflammation for people. And they might not realize that that could be a lever in their inflammation because we might not be thinking about it on a day-to-day basis.
I think I had that. Yeah. So you're looking, there's a specific gene or gene group or something that will tell you this, huh? Oh, interesting.
Yeah.
Cool. So should I be having my patients do all their genetic testing before I suggest that they do their fermented foods? Yeah. Okay. No. I'll send them to you for that.
Okay.
Yes, beforehand. So I'll also have people fast, or how I should say it this way. If somebody fasts regularly, if that's like part of their practice, I will utilize that as a tool leading into their procedure. If they don't fast, I actually don't have them start. It's not like, oh, you should fast leading into it, but it's unique how the evidence has evolved on this, when to fast, how to recover. And, I know like to utilize like fast mimicking types of diets, which has some like evidence behind it to support surgical pre-recovery, I'll say as well. But very interestingly to me, I think this is in a nutshell, it's the refeeding that is the benefit leading into my procedure. I don't want them coming in fasted.
Right.
I want them to fast before, then be in their refeeding, which is going to upregulate. For me, it's a lot of I was going to say growth hormone, but it's more growth factor related.
Stem cell
exactly.
support.
Stem cell mobilization. And it's the refeeding that really does it. What do you see with your patients who are doing fast mimicking? Because I know you like that quite a bit. Yeah.
Yeah, I think that a lot of people, there's some people do great with it, some people do not, but in general, like mental clarity, I think the research really goes around the kind of the cardiometabolic profile improvement over long periods of time where if someone just doesn't feel up to doing like a 5-day or 3 to 5 day fast with clear liquids, they can eat some food, but be able to still get some of the autophagy effects. Yeah. You're not turning on like the mTOR sensors to get kind of that cycle boost.
So you're the perfect person to ask this question too, actually, that I'm about to ask, because I get this all the time in various forms. Like I'll get in the ice bath and people will be like, oh, what do you think of women in the ice bath? Or fasting. What about women fasting? We know that there's physiologic differences. There's hormonal differences. There are all kinds of differences between men and women. And there's been a lot of attention drawn to women shouldn't ice bath or women shouldn't fast. And I honestly believe that to be not true as an absolute.
Right.
I think it's on the spectrum. Great. Like, does it have to be crazy intense? Does it you're like, the reason you're the perfect person to ask is that you have a functional medicine practice, you have a nutrition background, you understand women to a level that I don't. What is fast mimicking a good sort of, is there truth that women shouldn't fast? And is fast mimicking a good option within that if we still want some of the physiologic benefits or metabolic benefits that come with fasting? Just talk me through this.
Yeah, I think that I think fasting is a key component of life in general. We all should be fasting, right? But to different
Even
levels.
women.
Even women
Okay.
should
All
be
right.
fasting,
Okay.
yes. Obviously,
Yeah.
typically we fast overnight.
Right.
And, that window of time can be different for different people.
Mm-hmm.
And depending on their hormonal state, their metabolic state, in general, like premenopausal women tend to do better fasting for longer periods in their follicular phase, more estrogen dominant phase. You tend to also be able to maybe do a little bit higher intensity training as well. And then your luteal phase, typically you don't want to be doing as high of intensity of training and less fasting. And, it's all based on that hormonal cycle of building and kind of
Right.
repleting the body. So everything's in a cycle, and listening to where your hormones are at with the fasting piece can be a big game changer for women's metabolic health. Because if you're trying to fast at a time when your body is not optimized for fasting, then you're causing more stress. And more stress causes more inflammation, and you're not getting the benefits that you want to get out of it.
It's supposed to be a hormetic stress on purpose, right?
Right.
Like within a realm, and if it turns into not that, of course it's not good. I like that.
Like keeping up with, the hormetic, sauna. I always tell people, all those things are stressors, which are good and been shown to like bring more resilience to the body. But if you don't have enough antioxidant capacity to keep up with it, then it can decline your health. And there are also genes where you might be prone to more oxidative stress. And, symptomatically, there are people that might be overburdened with toxins or pathogens or gut imbalances where they don't tolerate as many hormetic interventions.
Yeah. You piqued me on this question a little bit too. In the Gen X and millennial, sort of generations with women, I would say it was, not uncommon to sort of be on a perpetual type of birth control, whether it was an oral version of contraception or whether it was an IUD that would essentially make you amenorrheic, right? Like, is that still happening? Is that a bad thing for people? Like, let's say you had your IUD and you're going to have it in for 5 or 10 years. What's that doing to women who are, not maybe perimenopausal, or some of them maybe in those generations getting perimenopausal? What's it doing? Is that something that you're like, stop doing that?
Not necessarily.
Okay.
I mean, if it's being used for birth control purposes, typically a lot of people do fine and don't have any negative side effects. In my mind of, balance, typically I like to mimic what would be natural in the body.
Yeah, you piqued me with the like building and breaking down
exactly.
phases.
And I think that sometimes later on in that perimenopausal time period when people have been, skipping periods and just having a birth control method, that's where I don't know if research-wise if, symptoms might occur earlier, but definitely symptoms are occurring where you might want to bring back in more of those bioidentical hormones.
So one of the preoperative things that I'll have my patients do too, and that I personally do, I just don't drink much in general, but I try to have my patients like limit their alcohol before and after for metabolic reasons, inflammatory reasons. It's a toxin, as you have said, right? What are your feelings on your patients' alcohol? Is there a specific way that you counsel them at all?
I mean, it is a toxin. So, and I individualize it. I think that things in moderation, and obviously we have our bucket that we're filling with various toxins. It's interesting that there are like the blue zones in different areas where they consume alcohol on a regular basis and have very good longevity data, but how much of that is related to kind of that social emotional component.
Right.
And if it's, I think at one of our conferences or something, someone asked about, well, the only time I drink maybe a beer or something is when I'm, golfing with my friends or something.
Yeah.
And, it's like, you don't stop golfing with your friends. And
Right.
sure, you could give up the one beer,
Yeah.
but as part of that experience, like you look at that whole picture and
Yeah.
that bucket and that quality of life.
Professor Galloway, I heard talk about this, and I thought it was very interesting because he's very focused on like what's happening with youth and their lack of interacting, dating, mating, what's going to happen to our birth rates and things like that. And so I kind of loved his counterpoint to what my actual life practice is, which is a little bit of like, you got to go out and get drinks with people and make some bad decisions and learn some life lessons. And it's funny to hear him talk. He fully acknowledges that, like, yeah, I don't know about the health stuff about it as much, but like it is that balance a little bit, you know, because I think about this all the time. I've actually probably moved past that phase of my life where I felt like the social pressure to do it, because there is, but now I think I've just adapted and learned other ways that, like, it probably doesn't actually affect my social life at all. But when honestly, when you first like stop drinking or don't drink, or I'm not like an absolutist. If somebody had made this delicious cocktail that they're passionate about and they're like, this is the most amazing thing, this is my life passion, try it. I'm like, yeah, let me try that, you know? But at the same time, I like can still have the social interactions without it. Trying not to make any bad decisions anymore, you know, like that type of thing. But I really thought that was an interesting. Wiser. Yeah, it's all the balance, right? Like taking that in. I really like that. But pre-surgically, nope. No bad decisions. I want everybody primed for that.
Yes.
And I had a patient recently, this is interesting too, like last week, who had filler 20-ish years prior. She was young. She had filler when she was really young, in her 40s now. One time having had filler, and we know that filler can get like a foreign body response, like systemic inflammation, whether it's like a vaccine, a teeth cleaning, you get a cold, you have allergic, you know, sinusitis, or for her, drinking alcohol would give her a reaction, an inflammatory reaction in her filler.
Interesting.
And so, I mean, I just was really like, you know, floored by that, from just like, not only is filler there 20 years later, which nobody believes until I remove it, you know, they're like, yep, there it is. Like, oh my gosh, nobody believes that. That's starting to change in our field. To the fact that, like, how inflammatory alcohol is this is systemic. Like, she's not pouring alcohol on her face. It's like she's drinking it and her face is lighting up. So yeah, there's a lot to it that way. That definitely illustrated to me just like, you know, another one of those like inner links right there. Yeah.
Impacts on the immune system.
For sure. Well, Leah, thank you so much for your time and sharing your expertise with us.
Thanks for having me.
Where can people find you? Where can people find you?
Clinic 5C.
Clinic 5C. Your Instagram. We'll link all those things in here. And yeah, thanks for taking care of me and my patients and sharing your knowledge.
I appreciate you.
Yeah, you too. If you have any questions or topics you would like me to explore further, please leave them in the comments. I read them all, and they often help shape the future conversations here. If you would like to learn more about my surgical practice, you can visit clinic5c.com, where you will find additional information on my approach to surgery, recovery, and performance-focused care. I also want to be clear that the views shared on this podcast are my own and are not associated with or representative of my clinical teaching affiliation with the University of Washington School of Medicine, nor should this be taken as individual medical advice. Thank you for spending your time with me. I appreciate you being here, and I will see you on the next episode.